Okay, good morning, everybody. Thank you for joining us for this session of Workforce Behind the Workforce, Employer Investments in Childcare. Introduce some of your presenters. My name is Tricia Leon. I am a Business Development Manager with First Children's Finance.
I'm Brian Lovedahl, CEO of CCM Health. We're a hospital located in Montevideo, about 350 employees or staff.
I'm Miranda Evenson. I am the new director at Little Hills in Madison.
And I'm Eric Beardy. I'm the CEO at Madison Healthcare Services in Madison, Minnesota, and the owner of a hospital clinic in nursing in the system.
So a little bit about First Children's Finance. We originally started out as a CDFI in 1991. We became a national nonprofit in 2006. We are born and raised in Minnesota, so our headquarters is in Minneapolis. We expanded to Michigan and Iowa, and we continue to grow today. We have a national team, and we just opened an office in Vermont this year. So what do? We really work on 3 different levels. We work on the individual child care provider level, doing consulting and training and financial modeling for startup child care programs and existing. We work on a community level to help grow sustainable childcare within communities, and then we work at a systems level, changing public systems through advocacy and expertise and really elevating childcare as a business, and some different ways to engage First Children's Finance. Regions and communities, we do what's called the Rural Child Care Innovation Program. We've done about 35 of those across the state. And it's an 18 to 24 month community engagement process, really focused on finding right-sized solutions for their child care crisis. We do Child Care Strategic Supply Plan, which is a 6 to 9 month community engagement process. We do supply and demand gap analysis for communities. So if you're looking at a specific area and you're wondering exactly what is the need in our region, we can tell you. And then community collaboration. Early care and education professionals and business owners can reach out to do startup or one-on-one consultations, CDFI lending, loans and grants, business analysis and modeling, and crisis response and support, which we did a lot of during COVID. And right now, thanks to funding from the Department of Human Services and the Southwest Initiative Foundation, all of our services are free of charge for providers and communities. So why does this matter? Access to quality child care and early education is vital to individual productivity and regional economic growth. We know that working parents cannot access and maintain productive employment without quality early care and education. We know that tomorrow's workforce will not be prepared to succeed in the global economy unless all children receive quality care and education today. And the return on investment in quality care and education today reduces long-term costs to the public and private sectors later on. So childcare challenges in Minnesota. From June of 2022 to June of 2023, Minnesota experienced a net loss of 320 childcare programs. We started tracking this data in 2018 prior to the pandemic, and this is a trend that we've seen every single year. And we're not talking individual slots, we're talking entire programs. So that's 320 childcare programs that were lost in the state of Minnesota. Each one of those could have been a family program of 10 to 14 children. It could have been a center with between 100 and 200 slots. We lose that many programs per year. The year prior to this, it was about 500, and that was the post-COVID hit, that we lost over 500 programs in 1 year. But 200 to 300 annually has been trending for several years. In 2021, 76% of Minnesota families had all available parents in the labor force in the past 12 months. And Chris Bevel, the editor of Prairie Business Magazine, really says it best. If employees can't find quality care for their children, they won't work for you. They won't move to your community, or they'll be forced to move away. Or they might have to even consider quitting their job to stay home with their children because they just have no other option. So we're going to look at some regional needs. So the child care need is high. We pull this report every single year. We do this every June. We pull this data, and the newest data has just been updated on our website for 2023. So this is as of June. We know that several of our communities have actually lost programs since then, so these numbers have grown. But Big Stone shows a need of 105. Swift is showing a surplus of 4, but individual communities within Swift County have very high deficits. Lac-Aparel is showing a need of 82. Chippewa, 198, and Yellow Medicine, 218. And then we look at family child care by the numbers. So family child care makes up the majority of slots in Region 6W. There are 93 total family child care providers in Region 6W, so in the 5 counties. And you can see the comparison to the state average up above. And we look at 2 categories really critically. We look at less than 5 years and more than 20 years. And we look at that for 2 really strategic reasons. Less than 5 years historically has a really high rate of turnover. So when family providers get into the business, that's when we see a lot of turnover really quickly. And it's either because they get into it and they realize the amount of work that it takes and the number of hours that they're operating, or they realize what it does to their home and the beating that their home takes, or they get into it out of panic. So there's kind of 2 reasons to get into childcare, passion or panic. You're really passionate about early childhood and you love seeing those aha moments and the development that comes with that first 5 years. Or you get into it because of panic, because you realized you have no other option. You found yourself pregnant and there's nobody available to take your child. Infant care is incredibly hard to find. And so a lot of times you'll see that first 5 years being a temporary plan. I'm gonna do this for 5 years until my kid's in kindergarten. Once my child is in kindergarten, I'm gonna get out of this and I'm gonna go into the field that I intended to go into in the first place. So that's why the first 5 years we see a lot of turnover. Then we look at more than 20 years, and hopefully that's for an obvious reason, because anybody who's done family childcare for 20 years deserves retirement. They deserve a long break after that. So 20 years we see them preparing for retirement. Or they may be operating a little bit differently because they can. They may be operating at lower capacity because they can. They can be pickier about who they take. They can be more strategic about the families that are in their program. When you look at those 2 categories, one that shows a high rate of turnover, and the other category that's showing imminent retirement, that's 55% of our family providers. So 55% of the majority of our slots are in those 2 categories with imminent closure. We look at non-owner occupied, so those are providers, they're family child care providers that are operating out of a home that they don't live in. So it's a home separate from the home that they reside in. And then we have non-residential dwelling, which are family programs that operate in spaces that are not necessarily homes. So that could be a church, it could be a storefront, it could be a wing of a business. So it's family child care that operates outside of a residential facility. When we do our RCCIP communities, one of the things that's part of that process is community surveying. So we've done community surveying all throughout the state. We survey family providers, center providers, employees, parents, and employers. And one of the questions that we ask is, has the availability of your preferred child care option impacted your decision to have another child or limit the size of your family? And from our communities from 2022 to 23, 55% of parents said yes. So when you see the need data that we shared previously, that's based off of births. Those are births that have actually happened in Region 6W. That doesn't even touch on the number of families, the 55% of families that claim they're holding off on having another child or even having their first child because childcare isn't available. So we're all from smaller rural communities. Imagine what happens to communities when the workforce stops growing. We're no longer having families that are the size that we wish that they were. We're limiting the size of our family, or in the case of this employee who wrote in, they don't have any kids at all yet. They'd love to, but they'd have to quit their job. We asked businesses and employers, has the shortage of childcare impacted your business? 68% of employers responded yes. The shortage of childcare has had a direct impact on their business. We ask parents, have you ever withdrawn from the workforce or declined employment due to childcare issues? And 35% of parents said yes. They have declined employment or withdrawn entirely from the workforce because of childcare issues. Then we also asked employers, has the childcare impacted your ability to attract or retain employees? And nearly 50% responded yes to both. We asked parents and employers the same question. To list any and all work issues that have occurred due to childcare arrangements in the last 12 months. You can see 77% of employers reported absenteeism from work strictly due to childcare. 54% tardiness to work. 35, inability to work different shifts. 39, inability to work overtime. And you can see the discrepancies between what parents report and what employers report. And I'll let you decide where that comes in. But it's really easy to say, my childcare's closed today, I can't come in. Because it's believable. So understanding childcare operations. So center childcare is organized under Rule 3. That's the Department of Human Services Rule 3. It's governed by the Department of Human Services. There are regional licensors now for center licensing. The majority still come out of the Twin Cities metro area. They regulate areas such as square footage, outdoor play space, toilets and sinks. We could add a really long list there, but we'll leave it at that. And there are multiple regulating agencies. Right now in Region 6W, there are 7 licensed child care centers. Now we're going to try and tackle the regional market rates. So in the state of Minnesota, the Department of Human Services conducts a statewide survey every few years, which looks at the prices that providers are charging and the prices that families can afford to pay. That survey is actually out right now to providers. We're at the end of the lifespan of this survey. This came out in the fall of 2020 and then was extended into the early spring or winter of 2021 in the depths of COVID when providers were already getting 8 million emails begging them to stay open. Hopefully they saw this one and actually filled it out. But this is what the survey is. And then they take all of those different prices and they kind of see trends. And they fall into 4 different price clusters. And then counties are assigned a price cluster based on the trending prices that are being charged in that community. You can see the 4 different price clusters up there. I've shown you the 75th percentile of the weekly rates for centers, meaning that 25% of centers in each price cluster is charging more than what you see here. 75% is charging what you see here or less in each price cluster. Because this is at the end of its life cycle, we see most centers charging what you see here or more because it's about to change. And then you can see the price cluster assignments. You can see that Swift, Chippewa, and Lac-Qui-Parle fall into price cluster 1. Yellow Medicine is in price cluster 2, and Big Stone is unassigned because at the time that this was done, they did not have a licensed child care center in Big Stone County. You can also see the drastic differences between price cluster 1 and price cluster 4. So when you're looking at these rates, this is also now, as of October 30th, this is what the Child Care Assistance Program will reimburse. It's the 75th percentile of the market rate. So this is what the reimbursement rates for child care assistance could be if the provider is charging that much. So when you look at the rates, you can see the drastic difference between price cluster 1 and price cluster 4. First Children's Finance just did the most recent cost of care study that should be out. I thought it was going to come out Friday. I think they had issues with the website, so hopefully this week. And you'll see that what providers are charging or what the expenses are to operate a program don't vary that much from price cluster 1 to price cluster 4. They're actually very similar. A popsicle does not cost more in Granite Falls than it does in Chaska. So the cost to provide care does not change. What changes is what you can charge and what parents can afford to pay. So the difference in pay for center staff is very minimal, actually. When we were looking at the averages, it was a matter of $2 an hour difference between the Twin Cities metro area and price cluster 1. It's strictly in what you can charge. So in price cluster 1, even though your expenses are the same, you're charging $180 a week for infant care. A program operating exactly the same in Chanhassen can charge up to $427 a week or more for the same service and with the same expenses. Family child care is organized under Rule 2. This is where family child care programs are licensed by the county. So there's individual county licensors, and so it's more local licensing. There are 93, as we said before, family child care providers in Region 6W, and their licensing is very different than centers. You can see the different categories up here. So there's A categories. The majority of programs that we see in Region 6W vary between a Class A, a C1, or a C2 license. And for good reason. When you get into that C3 category, you'll see that they can go up to 14, but now you have to have 2 people. And so while you had the income from 12 going to 1 family provider, you'd have to split the income from 14 to 2 providers when you go to a Class C. or a C3. So it drastically impacts their financial sustainability. And here's the regional market rates for family child care. Swift, Chippewa, Lackapaw, and Yellow Medicine all fall in price cluster 1, Big Stone in price cluster 2. And you can see the differences in rates. Where Centers nearly tripled between price cluster 1 and price cluster 3. Family child care does not even double between price cluster 1 and price cluster 4. So now we'll talk about some innovative solutions for employers and communities. So when we do our work throughout the state, we really focus on local resources, finding right-sized solutions, because a center is not the solution for every community. You have to know what your need is to know what you're accommodating. And then we really look at innovation, ways that we can use innovation to create a sustainable supply of childcare, because we don't want to just create something and not have it be sustainable. We want this to be a long-term solution and may even be a solution for the future, because of that 50% of families that are holding off on having more children. So employer-sponsored childcare. So this is family childcare. There's an excavating company that wanted to create a childcare program as a benefit to its employees. There's seasonal workers that have challenging schedules, and the company wanted to have control over the program because it was going to be a direct financial benefit to its employees. So their solution was to build and license its own employer-sponsored family childcare program. Some keys to success. The company creates the program as an employee benefit, and they were realistic regarding expenses. They do not expect the child care to become independently profitable. And they have an excellent working relationship with their county licensor to create innovative options within the child care licensing regulations. So as we showed those different classes of license, this program is able to flex between a C1, C2, and even a C3, because they do have the extra staff, depending on the number of infants that their employees need at any given time. They're very realistic. They know that even in the depths of January, as an excavating company, when their employees are dropping their children off at daycare, they're probably going ice fishing. They know that. They eat that, they know it, but they don't care, because those same employees are there when the ground thaws. They're not retraining staff, they're not recruiting new staff, they're not trying to hire new staff. They have seasoned veteran staff that are returning every single year to them, and they're able to get going faster, and they're able to take on more work, and this has become an incredibly valuable asset for their business. A nursing home childcare partnership. So there was a nursing home that needed childcare. They also needed to attract new employees. They needed to attract young families that would be moving to the area. They wanted to stay committed to their mission, and they were not interested in operating a childcare business. They knew they needed it, but they didn't want to own and operate it themselves. So their solution was to partner with a family childcare business to provide on-site childcare. This is more of a lease agreement. So the nursing home is really the landlord with an agreement with the child care program to come in and operate on-site child care. Some keys to success: having a strong legal contract between the two partners, having clear expectations and regular communication. It was a match between the philosophy of the nursing home and the family child care provider, and the family child care provider committed to operating a financially sustainable business. Now I'm going to introduce Brian Lovedahl to talk a little bit about CCM Health.
Yeah, thanks. So CCM Health, we've been around for a really long time, and I've been there for coming up on 6 years. And I started in 2018, and about 60% of our nurses on the hospital side were traveling nurses. And this was before the COVID crisis. There were other things going on in the organization, and it was that fall I hired a new chief operating officer, and we were talking about staffing issues, and she had said, "Oh, I have staff that want to work more, but they can't find childcare." And so that was kind of the first conversation that led to us saying, "Well, let's just start our own childcare center." And so that's really how we got into it. So we started down the path of creating our own child care center. We had some space available in our ambulance garage, actually. It was a meeting room that we converted. But it took about a year. It was a year-long process to just learn everything, hire staff, and get up and running. And this is something we've never tackled before. I mean, healthcare is highly regulated, but and childcare is too, especially when you get to the childcare center side of things. So there was a big learning curve there, and we were able to open up in January of 2020. And coincidentally, it was a week after I needed childcare for my children. It wasn't self-serving, but it definitely helped my family situation. And we have space for about 31 children in our childcare center. We are full. We're actually going to be renovating a new space and having space for about 70. We have a very young staff, and I think right now we probably have 8 nurses in our organization that are pregnant or just recently had children. So we need to hurry up and try to get this renovation done too, because there are current staff members that say, I want to come back to work, but I can't unless I can find childcare. So it's been highly successful. It's a huge recruitment tool. It's a huge retention tool. And just personally speaking, my wife works at the hospital, and if we didn't have childcare, she wouldn't be able to work. Well, then what does that do? I mean, because to our organization, and it's been highly successful. The first day we opened up, we had a nurse from outside of our area called us and said, "I just lost my childcare. I heard you guys have childcare." And we said, "We do." And so she started 2 weeks later. And when we started looking at traveling nursing costs, that was a big buzzword during COVID, was just how difficult it was to find staff in healthcare. The rates that were being charged for traveling nurses, $300 an hour. I mean, do that on full-time equivalent, you're looking at $500,000 a year for one person. Well, much like to what Tricia was saying, when we started down this path, this wasn't a money maker for our organization, but it was to save from additional costs. And we just you save one traveling nurse, and that pretty much that saves your bottom line for that organization, that department. And in healthcare, and Eric will attest to this too, we only make money in about half of our departments anyway. So what's another one? So that's our story.
Okay, now we're going to talk about Lackabarre Valley Schools, school district and community collaboration. So we've got Eric and Miranda.
Like I mentioned, I'm Eric Bierke, the CEO of Madison Healthcare Services, and I would just echo everything Brian said. You know, when I first started there back in 2015, that's exactly what we were looking at. You know, short staff, trying to figure out how do we keep people, you know, in Madison, working in Madison versus traveling to where there's a daycare and thus taking a job in maybe an outside town. And so there was that discussion early on that do we do our own daycare like say CCMH is doing? And we decided not to go that route. And in 2017, the city of Madison, along with some partners, had a community survey to kind of look at what are our top priorities on what should we focus our time on. So what are all the leaders need to be looking at? Daycare came up, of course, housing, community center, arts, those type of things. And after that conversation, getting the data back and those type of things, we met and just said, okay, why are we looking at the daycare? And you know, a few of the things that were going on at that time, we had some home daycares closing. So I think that we had three home daycare providers looking to quit. And so there's a lot of critical, okay, we gotta get on this as quickly as possible as a community, and maybe not just as the hospital or just as the city or the county or whatever it might have been. As I mentioned, we had our open positions, so we're losing folks to other communities. Young families were also moving to town. And so we could see a shift over in their teachers. So as you know, healthcare being the biggest employer, you know, in Madison, schools were right behind that. And so when there was a switch over in a lot of the teachers, a lot of retirements going on, a lot of younger families coming to town, and also in the farming community, there was a lot of younger families coming back to take over the family farms. So a lot of this stuff was going on back then to kind of push this conversation and to help that from a community outfit, you know, to say, okay, what do we do next? So during that time, between that community meeting in 2017, and then finally we got Little Eagles Daycare off the ground in February 2019, during that time, there was a meeting of the city city administrator, we had our mayor involved, we had a city council person on this little group getting together on how we're going to do this. Myself as a CEO, as a large employer in town, we had the Southwest Initiative Foundation helping us. First Children's Finance helped us, through some of this. Our superintendent for Lackboro schools, and then also our elementary principal for the Madison Elementary. And so we got together, just started brainstorming, how do we want to do this, looking at other options that were out there, what works for Madison in the sense of having slots. And we had a lot of those younger families, like Brian said, there's a lot of younger families pregnant, ready to have babies. What do? We got to get these spots because we don't want to lose those folks to either employment or from the school district in general, because that's a lot of enrollment that might go somewhere else to another school. And so we jumped on this conversation to put something together, and so when you look at, okay, how do we make this all work in the different avenues? Where CCMH kind of had that control and working on that, you had the complexity of working together on where are we going to put this, whose space is it going to be, who's going to pay for it, and all those type of things. So the schools had some space available, so that worked out well for us in the elementary. You had some financial backing from the hospital and the community members to try to get this off the ground. So paying for a little bit of the equipment that was needed, getting through the licensure, the regulation, it is very regulated, and it was very eye-opening for me as well on going through all that. And then having a very rounded team to really push this forward because there was a need. And so that was kind of where we went. We hired the daycare manager at that time, and she was very much involved with the process. And then, we got it running. And I will let Miranda kind of speak to sort of the daycare parts that I have no idea about. And I thank the Lord for them because, they can work with kids very, very well.
So my name is Miranda Evenson. I am the director at Little Eagles. Just going on 6 months now. A little bit about my background. I do come from family childcare as well. So I did that for 7 years prior to coming into this. And as Eric talks about kind of the licensing process and the regulations, they're still very different. And so for me to kind of roll up my sleeves and dig into kind of the regulations of the child care center versus the family child care was a challenge in itself, but just making sure that we're on the right track and we are in compliance with everything. I think the biggest thing for me is the involvement with the community, and so having people like Eric and Rick, the superintendent, to lean on and work with has been a great help in helping to adjust to the needs of the community. And I know Eric and I have had conversations as well as what are the needs. And I think the one thing over the last 6 months that has helped to be a little bit successful is to being able to move our target based on what the community does need. I know recently they added a new room into Prairie 5 into the Head Start. And so with that, looking at our enrollment, we were going to have all of our children in the preschool room. We're going to Prairie 5 Head Start but one kid. So that left me with, all right, now what do we do? So you need to get creative in that aspect and look outside of the box. And what that led me to do is to work on, how can we still support those kids, and not be, territorial, like, oh, they're going there and they're not coming here. But how can we work together? They're all our children. So right now they go to Prairie 5 Monday through Thursday during the day. They come see us in the morning, they come see us in the afternoon, and we see them all day on Friday. Not only did this help sustain the kids that we had, they stayed there with us, it also brought new kids in. So just looking at those needs and adjusting to kind of what the needs are. And I think the other big thing that I really enjoyed is Little Eagles, prior to me, has a parent group. It's 5 people that have kids enrolled. They are in our community. They're big supporters. I can reach out to them with anything. I need shelving, and in 4 hours, I had a shelf for car seats in my hallway. And just being able to reach out to them to help, and they're kind of a liaison between the community needs, but also, on the parent side, what do they need and how can we help support that? So I think one of the big challenges right now, well, a few of them, is staffing as a big thing. In July, we had our licensing review, and at that time we were partially licensed and partially certified. So I went the route of licensing our whole program versus the split, and just kind of looking at the numbers. And with that, we're able to now have 25 new spots for children, but we have to have the staffing to fill those spots also. And then hours were a big thing, and Eric and I work back and forth with hours. Right now, today, we're not where we need to be for hours in order to support his needs as far as early shifts. And I keep referring to Eric. Eric is a big part of our population. We have a lot of his staff who have children in our program. And so to be able to better support them is kind of our goal. And then, we've always had the Great Start, our grant funding. And now we have the Great Start compensation grant that we're able to use, which came out in October with new regulations. So with those new regulations, we have to put 100% of that back into our employees. So in a sense, that will help us hopefully recruit some new employees and help keep the ones who have been there. But then we look at in a rural community, the sustainability of being able to run our program. And that's where we have to reach out to our community for support and to help us, just kind of sustain and being able to serve the community and the needs.
Okay, so just some recommendations for everybody in the room. The first would be to truly understand the link between childcare, vibrant communities, and economic development. The second, connect with local partners, initiative foundations, Childcare Aware, and First Children's Finance. Protect existing early childhood investments. Seek new opportunities to sustain and expand, and invest in technical assistance and supports. Influence employers, community decision makers, and philanthropists. Create learning experiences for others to understand this link between childcare, workforce, and the economy, and really advocate for childcare funding with your state and national legislators. Now we have just a few minutes for questions. Does anybody have any questions for us or any of the panelists up here?
So a question for Brian and Eric, I guess, but Brian, first of all, is your facility open only to your healthcare employees?
Yeah, so it is only open to our staff, and we did that for a couple of reasons. And the main one is how we are reimbursed. So we are what's called a critical access hospital. So we receive reimbursement from Medicare, CMS, for our cost. So 50% of our patients are Medicare patients, 50% of our costs can be covered. Well, if you dilute your expenses with expenses that are not related to your staff, then those costs are not allowable. So now all of a sudden, if you lose, so right now, if I lose $100,000 initially, it really only becomes a $50,000 loss at the end. But if I was to dilute my patient or my customer base, say half of them were from the community, now this $100,000 loss, I only get $25,000 back. So that was the biggest reason why we only opened it up to our staff. And and I think in our community, we didn't want to take away from other childcare places either. We didn't want to be a driving force why Jane Doe down the street had to shut her childcare because everyone left their place to come to our place. Because our goal is for our community to have more childcare centers and more in-home facilities. And a perfect example, there was an individual who was an employee of ours for a while. She ended up leaving to start her own in-home childcare. Well, that's great. Yeah, that caused a little staffing crisis for us, but look what it's doing for the community by getting her out there. She gained the experience and the knowledge with our organization, but then is bringing that out to the community.
So then, the employees who have children there, is that free to them?
Nope, it is not. So we charge kind of the local rate, as Trish was talking about. We did an analysis of what everyone is charging, and I mean, the numbers that she put up there is spot on. It's what for my two girls are 4 years old now, it costs us about $13,000 a year for those two. And talk about the price clusters, I came from Hudson, Wisconsin, in that area, and it was gonna be close to $40,000 if those two kids right now. Well, what housekeeper, what registration person can afford $40,000 worth of childcare for their two kids? No wonder people aren't working. But
So then, Eric, when you partner with the facility there, do you subsidize your employees into that facility?
So we don't pay anything to the employees per se, but we do subsidize the program itself. So we do help fund any losses that the program might foresee over say a fiscal year. The EDA also in Madison also does the same thing. So between the two of us, we're probably the two biggest funders to help that when that would happen. As we all know, daycares aren't going to make money. So it's hopefully to break even. And that's what we've been doing ever since it started, is to do it that way.
Okay.
I've got a question for Brian and Eric. Have you guys seen your traveling nurse staff population go way down because of this?
I know that we've had people that have left, that haven't left the organization because they've had childcare, or that people are concerned about leaving because they would lose childcare. So it's a huge retention side of things. Now, as far as recruitment, absolutely, we're able to recruit much easier because of the childcare. But we've had people apply, and actually our director of HR is here, so she could attest to this too. So childcare does report to her because I believe childcare is an HR issue. And but we've had people call us and say, you have childcare? Yes, but we're full. And it's just kind of like, well, sorry, because they were really excited because we had childcare we could offer, but then we're full, so they can't utilize it right now. So that's been really disheartening. And we know we could have recruited more people if we had more openings.
Yeah, at the start, it was more of a sustaining and retention, and not having an increase. I mean, the COVID came into effect after that, and so that, it's hard to say if the daycare would have helped that even more. But now with the program being where it's at and improving over time, now we're starting to see that slight change in reducing our agency due to the daycare, because some of these nurses are having their newborns now, and that were maybe a little younger than and not having a family quite yet, but now they're starting to have their babies and able to have a daycare. So if it wasn't for that, the newborn slots in town, it's non-existent.
I have a question. I know you had mentioned the Great Start Compensation Grant. Are there any other startup grants or anything that would help companies if they wanted to start a daycare for employees?
You look at me and I'm looking at Marge.
I'm Marge with Prairie 5 Childcare Aware, and one of the things that we do is we support the providers, both centers and family childcare. We don't actually do the licensing. We're funded by DHS, and we are given a small amount for startup funds. But if we are working with us, if somebody is interested in doing childcare, we'll work with them on what are all the possible grants out there, what are the connections. We're kind of the behind the scene supporting them in getting their license. And then once they're licensed, we do retention as well. So if, when you talk about providers starting, and usually we say, if they make it to their second year, that's good. It's usually they feel like they're on an island by themselves and know where to go. And so hopefully we can support them through that process. So to answer your question, yes, there are funds out there, definitely not enough funding. But we will have usually a list of funds that we can at least guide them to apply.
And there were facility grants for the last 2 years that actually really helped with startups and existing providers, and that funding was not renewed by the legislature this past year. So it was a huge amount of money that was not actually renewed. So we're at about our time today, so I just want to leave you with some resources. So if you're interested in that childcare need and you want to see the need by zip code, it has just been updated as of Friday. So if you want to scan the QR code, or if you go to ruralchildcare.org, you can see the need for every single zip code in the state of Minnesota. It's broken down by region, county, but you may find it interesting. And then you can see comparisons from previous years to see exactly where we're sitting. I believe the overall need for the state of Minnesota is over 99,000 childcare slots right now. That's it. Thank you all. If anybody has any questions, we'll stay back, but thank you for joining us today.